Sanjay Ugare, Assistant Professor, Department of Pharmacology, Kelly College of Pharmacy, Belgavi. Today, we are going to discuss on the topic of the Parkinsonism disease. It is an already known. This is one of the neurodegenerative disorder affecting the mainly CNS part of the body. There is a loss of the neurons in the one part of the CNS. There is a degeneration of the neurons that may lead to the different neurodegenerative disorder. Parkinsonism is one of the neurodegenerative disorder affecting the mainly substantial nigra of the pars compacta. Regarding on this concept, we'll discuss on what are the etiologies, what are the pathogenesis, and what are the drugs are used for the treatment of the Parkinsonism disorder. Sir, 1 second. These are the contents of the today topics. Today we'll discuss basic introduction of the Parkinsonism disorder. What are the pharmacological concept of the Parkinsonism disorder, and what are the etiology, what are the symptoms, signs and symptoms, pathogenesis, and what are the drugs are used available for the treatment of the Parkinsonism. Come to the basic introduction of the Parkinsonism disorder. Already I told this is one of the neurodegenerative disorders, and it is a irreversible process. If it is affecting, it is not a recovery of the patient is a very rare, and it is that's why you can use the term irreversible loss of the neurons from the specific region of the brain. And mainly what are the different today we'll discuss only Parkinsonism disorder, but what are the different degenerative disorders are available where the loss of the neurons from the usually basal ganglia and usually results in the abnormality of control of the movement. These are all like Parkinsonism disorder, Huntington's disorder, Alzheimer's disorder. These are all coming under the category of the neurodegenerative disorder, where they affecting the mainly substantial nigra of the pars compacta. Alzheimer's is also one of the neurodegenerative disorder, where the loss of the neurons from the hippocampus, where the Parkinsonism disorder, where the loss of the neurons usually from the basal ganglia of the CNS. And what are the usually you'll get the impairment of the memories and cognitive abilities. These are the symptoms usually getting in the patient. Come to the today's concept of the neurodegenerative disorder, that is Parkinsonism disorder. It is a motor disorders. Mainly symptom. What are the major symptoms are tremor, rigidity, hypokinesia, with the secondary manifestations like defective postures, gait, mask-like face, siluria means saliva is coming up from the mouth. Dementia may occur. And if you untreated these symptoms, the disease may progress for several years to the end stage, in which the patient is very rigid, unable to move the parts, unable to breathe properly, affecting also the respiratory system. And this is one of the major disorders is discovered by the James Parkinsonism in the year 1817. That's why the name of the disease is called as the Parkinsonism disease. And the major reasons is the Parkinsonism disorder is mainly already told. It is mainly affecting the substantial nigra of the pars compacta in the CNS, where there is a degeneration of the dopamine is there in this part, and this results in the deficiency of the dopamine in the stratum, which controls the muscle tones and coordinates the movement. That's why you're getting the improper muscle movement and coordination movement usually getting in this patient. And it is considered as the imbalance between the dopaminergic, that is inhibitory, and cholinergic systems in the stratum occurs, giving rise to the motor defect in the body. And these are, you can see the healthy brain where there is a loss of the dopaminergic neurons in the, especially in the dopaminergic, especially in the substantial nigra of the pars compacta occurs in the Parkinsonism disorder. You can see the difference between the healthy brains and Parkinsonism disorder brain. Then what are the factors that will be affecting the Parkinsonism disease, especially in the patient? There may be different factors that is responsible for the causation of the Parkinsonism. Some are environmental factors, some are genetic factors that will be affecting the Parkinsonism disorder. we go for the scientific evidence for the genetic factors responsible for the causation of the Parkinsonism. There are which proteins is affected in the patient, and which are the amino acid, particularly amino acid responsible for the causation of the Parkinsonism disorder. This concept will discuss, and usually it is affecting the older age people, more than above 60 years, especially in the women. You can find this type of the symptoms. Already I told it is not a reversible disorder. It is one of the irreversible disorder. You can manage the disorder, but you can't cure the disorder. And these are maybe oxidative stress is also one of the genetic factors responsible for the causation of the Parkinsonism disorder. Oxidative metabolism of the dopamines due to there is the dopamine metabolism of the dopamines may yield the product called as the hydrogen peroxide, other reactive oxygens. Oxidative stress and consistent cell death and develops the substantial nigra under the circumstance which there is a increase the dopamine turnover. There is a concentration of the dopamine will be increased, resulting in excessive peroxide formation. Deficiency of this is one more important enzyme that is also responsible for the causation of the Parkinsonism, that is glutathione, thereby diminishing the brain capacity to clear the hydrogen peroxide. This is also one of the important factors. Apart from the causing the Parkinsonism, it is also responsible for causing the hepatotoxicity. Increase in the concentration of the again H2O hydrogen peroxide lead to the reaction with the ferrous iron that generates the highly reactive and potentially cytotoxic radicals that degrade the dopamine neurons in the brain. And this deficiency of the neurons may lead to the formation of the clumps, that is the misfolded proteins will get in the substantial nigra of the pars compact of the brain, where the proteins are get misfolded within the neurons. They may lead to the that are called as the misfolded that is the misfolded proteins. They are also called as the Lewy bodies, or they are called as the nucleus of the proteins. The misfolded proteins form the small repeated units called as the oligomers or longer fibrils, which are toxic to the neurons and play a key role in the Parkinsonism disorder. Okay, this if the proteins got misfolded, and there is a things may be responsible for the causing the Parkinsonism in the patient. And these are some genetic factors. Usually they have identified scientifically that will be defect in these amino acids may be responsible for the Parkinsonism disorder, where there is a mutation of these amino acids, especially in the Parkinsonism disorder, occurs in the patient. SNCA is the one of the amino acids that makes the proteins alpha synuclein. In the brains of the individual Parkinsonism, this protein aggregates the clumps called as that helps in the formation of the Lewy bodies. And the mutation of the SNGA gene are found especially in the early onset of the Parkinsonism disorder. Usually get in the before causing of symptoms, before causing the major symptoms of the Parkinson. It is get in the early stages, not in the later stages. You can see the Lewy bodies, histophysiological images of the Lewy bodies also is there in the diagrammatic representation. These are all called as a nucleus that are that helps in the misfolding of the proteins in the patients. These are other genetic factors, that is PARK2 is another genetic factor. Mutation of these factors or genes may be also responsible for causing the misfolding of the proteins. Apart from the PARK2, PARK7 and PINK1, LRRK2, these are all different genes that will be defecting in the Parkinsonism patients. And what are the symptoms you can get in the patient? Usually affecting the if the Parkinson is a patient not able to write properly, their handwriting is very weak. You can see some diagrammatic representation of the handwriting, how the Parkinsonism they can't be able to follow the systematic flow of the writing part, and the handwriting is again you can not able to understand it properly, and also they can't able to go in a schematic, that is based on the lines, they won't follow the lines also. These are again some of the symptoms you can find in the Parkinsonism patients, aggravated by the emotional stress or increase the concentration, pill rolling, rotary motion of the thumb and forefinger. These are the symptoms usually get in the Parkinsonism patient. And apart from that, you also have a bradykinesia symptoms, then blinking of the eyes, swinging of the arms while walking, swallowing of the there is a difficulty in the swallowing of the saliva, self-expression with the facial and hand movement, lack of the spontaneous activities, lack of the postural adjustment, and this result in the stopped postures, masked face, dropping of the saliva, and shifting of the gaits. Then another symptoms, rigidities, increase the resistance to the passive motions where the limb are moved through their range of the motions, normal motion, and cogwheel rigidity. These are all symptoms of the Parkinsonism patients. Other extrapyramidal effect of the Parkinsonism, affecting the extrapyramidal part of the brains, usually that is silarohia, that is excessive salivation from the mouth, and microphagia, typical gait, defective postures, excessive blinking and dementia, and decrease the speech volume. Okay, if the person is talking, not able to listen, somebody other people not able to listen properly. And you can see the how the physical behavior of the persons, usually the Parkinsonism symptoms affecting like these are the Parkinsonism patients. You can see the how the body's different parts, hand and muscle, face, different parts of how they are affecting in the persons. These are non-motor symptoms where the loss of the sense of the smell, sleep problems, constipation may also occur, depression in the some of the patients may also observe in the non-motor symptoms. And the basal ganglia or nuclear are usually heavily interconnected and play important role in the, these are basal ganglia mainly controlling the motor planning and modulation functions. Then the basal ganglia usually have two pathways, that is direct pathways and indirect pathways. In case of the Parkinsonism, these pathways are usually affected in the patients. This is how the synthesis and inactivation of the dopamine usually occurs in the bodies. And already I told there is a starting only beginning, there is an imbalance between the cholinergic system and imbalance between the dopaminergic system may lead to the Parkinsonism disorder. You should manage the both the neurotransmitters are responsible for the management of the Parkinsonism. If there is any variation in these two neurotransmitters may affect the Parkinsonism. That's why you have using the inhibiting the management of acetylcholine neurons and management of the dopamine neurons drugs are available in the market. Coming to the pharmacological concept of the Parkinsonism disease, you have a list of category drugs are available for the treatment of the Parkinsonism drugs. You have drugs affecting the brain dopaminergic systems and drugs affecting the brain cholinergic systems. You have dopamine precursors, levodopa, dopaminergic agonist, bromocriptine, ripinerolol, and COMT inhibitor available. You should inhibit this enzyme, and entacapone and tolcapone, and some again subcategory of the again drug affecting the peripheral decarboxylase inhibitor, that is carbidopa, then benserazide, then MAO, monoamino oxidase B inhibiting drugs, salicylic, rasagiline, then glutamate inhibiting drugs, glutamate agonist drugs are available, that is amantadine. These are some few drugs that usually acting on their own receptor helps in the management of the Parkinsonism disorder. And come to the individual category of the drugs, that is dopamine precursor, levodopa. It is an usually you can't give the dopamine because it is not able to cross the blood-brain barriers. That's why we synthesize the chemically levodopa molecule. Then again it crosses, after crossing the blood-brain barrier, it is converted into the dopamine and starts acting on the dopaminergic receptor and show the its therapeutic effect in the bodies. And after release, it is transported back into the again dopaminergic terminals by the presynaptic uptake mechanism metabolism by the activation of the MAO and catecholamine transferase. And unfortunately, with the time, the number of the neurons are get decreasing in the Parkinson's patient, and in the after giving these drugs, and the fewer cells are capable of converting the exogenous administration levodopa to the dopamine. Consequently, motor functions fluctuation can be developed in the patient. Once if you injected the levodopa after it crossing the blood-brain barriers, then usually there is a terminals of the presynaptic uptake of the mechanism, that is the metabolism by the action of the MAO and catecholamine transferase usually occurs, and that will be lead to the development of the Parkinsonism. And relief this relief proved by the levodopa is only symptomatic, and it lasts only while the drug is present in the body. And if we can not individual drug, you can see the combination of the drugs is also show the better therapeutic effect in the patients. If you give the levodopa and carbidopa combination, you get the better therapeutic effect in the patient. And if the levodopa is administered alone, then the drug is already I told drug is individual. Instead of giving the individual molecule, if you give the combination, then you get better therapeutic effect. If you give the individual molecule, it is largely decarboxylated by the enzyme in the intestinal mucosa and other peripheral sites. And little unchanged drug reaches the cerebral circulation, and probabilities that is lesser 1% of the penetration in the CNS part will be observed. Come to the pharmacokinetic properties. Observed rapidly from the small intestine by utilizing the active transport process, and gastric emptying. If slow levodopa is exposed by degrading the enzyme present in the gut wall and liver for long times. Amino acid present in the food compete for the same carrier for absorptions, and high fast metabolism usually occurs, and the plasma half-life is 1 to 2 hours in the patient. And action on the CNS effect is already told. These are used for mainly treatment of the Parkinsonism disorder, mainly controlling the motor functions, and usually the eliminating the most of the symptoms like bradykinesia. It helps in the reducing the bradykinesia, tremor, rigidity symptoms, and secondary symptoms like posterior gait, handwriting can be improved in the patients. And apart from that, the speech, facial expression also improves in the patient gradually. And these are major drugs mainly affecting on the CNS, but you have to check the what are the effect of these drugs on the other organs also, like on the CVS. It causes the bradycardia. You can mention in the adverse effect of the drugs also here, by acting on the beta receptors. Due to the central action, postural hypotension is also observed in the patient, and stimulation of the dopamine also lead to the nausea and vomiting. These are other adverse effects usually getting in the patient. And if we act on the endocrines, it also causes the decrease in the prolactin levels and increases the growth hormone level secretion in the patient. These are adverse effect. All other things I explained, same highlighted adverse effect. And prolonged therapy, excessive abnormality used for whenever there is a need for a prolonged therapy. Excessive abnormality, involuntary movements, like prolonged therapy in these conditions, movement of the facial tics, grimacing, tongue thrustings, and movement of the limb after the month of the treatment, and behavioral effect, trouble in thinking. Levodopa can induce the anxieties, psychosis, confusions, hallucination. These are other pharmacological effects you can mention these molecules. And it is usually interacting with the antipsychotic drugs, antihypertensive drugs, and reserpine molecules, and non-selective MAO inhibiting drugs. And the second category of the drugs used for the treatment of the Parkinsonism is the carbidopa, and that is a peripheral decarboxylase inhibiting drugs, that is carbidopa and benserazide. These are two drugs usually that will be inhibiting the peripheral decarboxylase. These are mainly acting on the extracerebral dopa decarboxylase inhibiting. They do not penetrate the barrier and do not inhibit the conversion of the levodopa to the dopamine in the brain. Administration along with the levodopa, they increases the what is that I told advantages of the giving the combination. If you give the combination, they increases the T half-life in the periphery and make them more available to cross the blood-brain barrier and reaches into the site of the actions. Okay, that's why the combination effect is a very therapeutic effect, show the better therapeutic effect in the patient. Usually, the T half-life of the patient, T half-life of the drugs usually increases in the patient. This is the advantages. Cardiac complications are minimized. Systemic concentration of the dopamine is reduced, and some of the adverse effects like nausea, minor adverse effect, nausea and vomiting also can be minimized. Next, come to the other category of drugs, that is dopaminergic agonist drugs, acting on the dopamine receptors, mainly ropinirole and pramipixole. These are two drugs mainly act on the striatal dopamine receptor. Even in the advanced patient have largely lost the capacity to synthesize, store, and release the dopamine from the administration of the dopamine. And the two drugs like ropinirole, these agents have a replaced by the older agents, that is bromocriptines, and previously bromocriptine is using to show the inhibit the dopaminergic neurons. Usually nowadays the newer drugs are available, that is ripiniroles and pramixerol. Previously bromocriptine and pergilloid the molecules are using. And pergilloid is usually withdrawn from the US in the 2007 because of some of the cardiac adverse effect, usually cardiac fibrosis and other adverse effect. Cardiac fibrosis is a major adverse effect you usually get in the patient. It is banned in the US. And they act on the mainly D2 and DT3 receptors, and little or no activity on the receptor. Mainly they are targeting the D2 and D3 receptors in the body. This is older molecules. It is also natural alkaloid. It is a ergot derivatives mainly act on the D2, but partial agonists and antagonists to the D1 receptors. Mainly the improvement of the symptoms usually occurs within the 30 to 60 minutes of an oral dose, and last up to the duration is last up to 10 hours. Then already told these have been largely replaced by the ropinirole molecules and primipixole molecules. These are newer drugs used for acting on the D2 and D3 receptors. Some gastric irritation of these two molecules, GI gastrointestinal, that is irritation, that is mainly nausea and vomiting, and some headache, drowsiness, confusion occurs, and some cardiac dysarthmiasis, that is mainly causing the bradycardia. These are other adverse effects can be found in the patient. Next, come to the monoamino oxidase inhibiting drugs. That is, these are also called as MAO inhibiting drugs. That is salicylic, and one more drug is available, that is rasagiline. These are two molecules that act on the monoamino oxidase enzyme. Mainly these are called as the MAO inhibiting drugs. These are two isoenzymes that is mainly acting on the MAO and MAO and MAOBB enzymes. Both are present peripherally and inactivate the monoamino intestinal origin. Then MAOB is a predominant form in the stratum and is responsible for the most of the oxidative metabolism, oxidative metabolism of the dopamine in the brain. And inhibition of this MAOB raises the brain dopaminergic levels without affecting the other transmitter amines, because the salicylic and rasagiline selectively inhibit the MAOB molecules, MAOB enzyme. And some adverse effect of these two molecules, like posterior hypotension, then involuntary movement. Usually these are two major adverse effects, and also they are metabolized usually by the liver into the amphetamine and causing the insomnia in the patient. Then COMT inhibiting drugs, that is entacapone and tolcapone. These are two molecules. These are very potent and reversible COMT. They can be reversible effect can also found in the patients. And entacapone have been introduced as adjuvant to the levodopa and carbidopa combination. They are used as adjuvant to the levodopa and carbidopa molecules in the advanced Parkinsonism disorders. They are reversible competitive inhibitors of the COMT and thereby reducing the metabolism of the L-dopa and increasing the availability with the nigrostriatal nerve fibers. And it is relatively specific for the CNS COMT with a little effect on the peripheral COMT, thus causing the increased brain concentration of the levodopa. Both the drugs, these drugs prolongs the therapeutic effect of the levodopa and carbidopa in the advanced patients. And the same adverse effect compared to the similar molecules, nausea and vomiting are common for all the anti-Parkinsonism disorders, and hepatitis rare with the entacapone, and urine discoloration is also observed in some of the patients. Then glutamate agonist, that is amantadine, is the very molecule. It is used as an antiviral for prophylaxis of the influenza A virus. It blocks the NMDA glutamate receptor, mainly acting on the NMDA receptors. It acts rapidly but lower efficacy with than the low levodopa, which is equivalent to the higher than the anticholinergic drugs. It promotes the presynaptic synthesis of and release of the dopamine in the brain and has a anticholinergic properties. And it is mainly preferred in the milder cases or in short-term course of supplemented to the levodopa for the advanced cases. In the later situation, it serves as suppressor the motor fluctuations and abnormal movements. Some adverse effect GIT in the upset and dryness of the mouth, CNS toxic like nightmares, insomnia, dizziness, hallucination, and convulsions may also occur in the patient. Impairment of the memories, blurred visions, these are other adverse effects. Okay, these are the reference for this topic. This is all today's discussion. Today we discussed what is Parkinsonism, what are the different symptoms of the Parkinsonism disorder, what are the factors that will be responsible for the causation of the Parkinsonism disorders, mainly some of the few environmental factors, some of the genetic factors. In genetic factors, what are the proteins are defected, mutation of the some proteins will be occurring. If you stop the mutation of these proteins, you can manage the Parkinsonism disorder. And these are one of the not reversible, these are irreversible disorders. You can call it as a irreversible because it is not curable. You can manage the disorders by using some of the anti-Parkinsonism drugs. Some are MAOB inhibiting drugs, COMT inhibiting drugs. These are major drugs. And if you use instead of taking the individual molecule, if you take the combination, you can prolong the effect and prolong the viability of the molecules. The half-life can be increased in the patient and helps in the proper management of the Parkinsonism. With this regards, I will regarding the information on the Parkinsonism, I'll thank you for the session. Thank you.